My name is Shahzad Ahmad. I've been an endocrinologist practicing for more than 12 years, specializing in the treatment of thyroid and parathyroid and general endocrine conditions. This has been a fun place to grow. We work with an energetic young team, which makes it easier for us to deliver fast, cutting-edge care in a compassionate and conscientious manner. We specialize in thyroid and parathyroid imaging more so than other things. But we do treat the general spectrum of endocrinology that you would normally see. Slightly underserved as endocrinologists are in most places in the country. There is a shortage, and so we try our best to fulfill the needs of the community we all live in, and we enjoy living here in Utah. I'm assisted by my partners. That makes it easier when you have a team to support you through tougher conditions. Our institute started with the kind of humble beginnings. We had a small office, me and my nurse, and now we have a staff of, I think upwards of 20 people. What I'd like to say in terms of what differentiates us from the care that used to be available before we got here is that I think we've streamlined things quite a bit. We make sure that blood tests, their patient's previous records, their imaging, their procedures, all of those are done at a rapid pace to make it convenient for the patient to get appropriate diagnosis in a timely fashion, and then dealing with those results and being able to work with a different group of physicians with different specialties, and having a team's focused approach to treat different conditions. Endocrinology makes a lot more sense in terms of balance and negative and positive feedback loops, which to a mathematically oriented mind might appeal, or to a less aesthetic type of person like me also it appeals, because it makes sense most of the times. There's always an explanation for why things are happening. Now, we don't know everything, but in terms of there being less mysteries in endocrinology, I'd say, yeah, there's less mystery in this. We can look at things and have a good understanding of what is going wrong. And another thing that makes it more appealing for me, I'm basically more of a action-oriented person who likes to get things done, kind of like a little bit of a go-getter, I would say. And when it comes to thyroid cancer and thyroid-associated diseases, we are able to treat most of them more successfully compared to some other cancers which are, more resistant to treatment and stuff. And obviously that's not to say that it's easy, but obviously the fact that you're able to treat this more aggressively, more successfully, does give you a more positive outlook on life and medicine and your day. You're more upbeat about it because you have more leverage against this disease. And most of us physicians are human. We don't like losing, and being able to win against cancer, yeah, that's always a good feeling to have. It makes you get out of bed every morning. So yeah, that's another reason that I liked endocrinology, and especially thyroid diseases and thyroid cancers.